When you're constipated, you either don't go to the bathroom as frequently as you should or have trouble passing the stool. Constipation is often defined as having fewer than 3 bowel motions in a week. But everyone has a different timetable for using the toilet. There are individuals who have multiple bowel motions daily, while others have one daily or every other day. You may have to strain when trying to use the restroom due to hard stools. Bloating and stomach pain are further signs of chronic constipation. As an occasional constipation remedy, castor oil can be beneficial, and today in this video we will discuss in depth about use of castor oil to get rid of constipation. Before we begin, please note that information provided in this video is for educational purposes only. Castor oil, what is it? The castor bean is the source of castor oil. Although this oil has been used as a laxative for thousands of years, scientists have just lately discovered its mechanism of action. The primary fatty acid in castor oil, ricinoleic acid, has been found by researchers to attach to receptors on the smooth muscle cells in the intestinal walls. Similar to other stimulant laxatives, ricinoleic acid induces the muscles in these areas to contract and push out stool once it connects to these receptors. Castor oil has been used to induce labor since it has a comparable impact on the uterus. There is some evidence that castor oil relieves constipation rapidly and effectively. Using castor oil reduced straining and improved constipation symptoms, according to a 2011 research of older persons with persistent constipation. How to use castor oil? Castor oil is a liquid that is consumed orally. It acts fast, thus it's usually taken during the day. Adult constipation is treated with 15 milliliters of castor oil. Try chilling the castor oil for at least an hour in the refrigerator to cover up the taste. Next, incorporate it into an entire glass of fruit juice. Preparations of flavored castor oil are also available. Castor oil has a rapid action. After taking it, you ought to start seeing results in 2 to 6 hours. As with other laxatives, it is not a good idea to take castor oil right before bed because it acts so quickly. Castor oil should not be taken continuously, just like any stimulant laxative. It can eventually cause your intestines' muscle tone to decrease, which might result in persistent constipation. Consult your physician if your constipation persists. Concerns about safety. Not everyone is a good fit for castor oil. It is not advised for those with specific medical issues or pregnant women. Castor oil is not advised to be used when pregnant since it can cause the uterus to contract. Additionally, children under the age of 12 should not regularly use it. Before giving your child castor oil, have a conversation with their pediatrician. Castor oil consumption over an extended period of time may exacerbate intestinal issues in persons over the age of 60. It may also cause your body's potassium levels to drop. If you use any of the following medications like diuretics, antibiotics, blood thinners, and cardiac medications, you may need to avoid castor oil. Castor oil has a taste that many find disagreeable and a few negative side effects. It can result in cramps and diarrhea, just as other stimulant laxatives. It may also lessen the amount of nutrients that your intestines absorb. Constipation causes. Constipation frequently has dietary causes. Your stool will become dry and hard if you don't consume enough water and fiber. Your stool won't pass through your intestines with ease after this. Additionally, constipation is an adverse effect of some medications like antacids, anti-seizure medications, blood pressure-lowering medications, iron-related supplements, sedatives, narcotic pain remedies, and a few depression medications. Constipation might also result from specific medical disorders like constriction of the colon, colon cancer, various gastrointestinal cancers, and diseases that impair the muscles in the intestines, such as multiple sclerosis, Parkinson's disease, and stroke, diabetes, hypothyroidism, or underactive thyroid gland. Some people discover that they experience intermittent constipation. Hormonal changes during pregnancy might cause constipation in women. Aging also causes bowel motions to slow down, which can cause persistent constipation in certain older persons. How to avoid constipation? Diet and exercise are frequently the most effective ways to avoid constipation. Increase your intake of fiber by including whole grains, fruits, and vegetables in your meals. Fiber makes feces softer and facilitates their easier passage through the digestive system. For every 1,000 calories you eat, try to get 14 grams of fiber. To make your feces softer, increase your fluid intake as well. Make time to exercise most days of the week. Exercise builds the muscles in your intestines just like it does the muscles in your arms and legs. Make an effort to use the restroom at the same time every day. When using the restroom, take your time. Give yourself some time to sit down and have a bowel movement. Additional laxatives. Laxatives come in a variety of forms and are used to treat constipation. Here are a few possibilities. Supplements of fiber. Supplementing with fiber increases the weight of your feces, making it easier to pass. Osmotics. Miralax, polyethylene glycol, and milk of magnesia are two examples of osmotics. To help soften the stool, these aid in retaining fluid. Stool softening agents. In order to soften the stool and minimize straining during bowel movements, stool softeners such as Colace and Surfak add fluid to the stool. Stimulants. Stimulants cause the intestines to contract, which forces feces out. Although these laxatives work well, they can have unfavorable side effects like diarrhea. One way to relieve constipation is with castor oil. Your intestines' muscles tighten as a result, forcing feces out. It's not suitable for everyone, though, and it does have certain negative effects. Additionally, using castor oil as a long-term constipation remedy is not advised. Consult your doctor about other treatment choices if you're having constipation frequently and aren't able to find relief. Like, share, and subscribe for more educational videos like this.